After more than 30 years working in operating rooms and rehabilitation wards, I have noticed a pattern most people never hear until it is too late. Many older adults believe stretching each morning is enough to protect their mobility, but stretching only lengthens tissue. It does not activate the muscles that stabilize joints, support circulation, and prepare the body to move. Without activation, the first steps of the day happen with cold muscles, reduced responsiveness, and weaker joint support. That is when instability and injury risk quietly begin to rise. In mobility recovery programs, seniors who perform targeted activation movements before standing consistently show better coordination and lower limb responsiveness than those relying on stretching alone. In this video, we will look at 5 bed exercises ranked from least impactful to most effective for activating the body before the first step of the day. One movement in particular repeatedly produces the strongest stability response, and that exercise holds the #1 position in today's ranking. Stay with me through the list, because number 2 may significantly influence how steady you feel when standing each morning. Number 5 is ankle pumps and circles. This movement is often underestimated, but it is routinely prescribed in medical settings, especially after hip or knee replacement surgery. Its role is simple but important. It prepares circulation and ankle stability before the first step of the day. After long periods in bed, this becomes the first activation step that helps reduce both vascular and balance risks. During prolonged bed rest, the calf muscles remain inactive and venous blood begins pooling in the lower legs. Normally, the calf muscles act as a secondary circulatory pump that helps move blood back toward the heart. When they are not contracting, circulation slows. Ankle pumps activate the gastrocnemius, the soleus, and the smaller stabilizing muscles around the ankle joint. Each contraction pushes blood upward toward the heart, while the full range of ankle motion activates stabilizers that support balance when standing. Research highlights the importance of this activation. A study published in the journal Thrombosis Research found that adults over 75 who spent more than 8 hours in bed without lower leg activation had a 260% higher risk of developing deep vein thrombosis, or DVT. Additional clinical references from the American Academy of Orthopedic Surgeons indicate that ankle stabilizer muscles contribute nearly 60% of balance control when standing. To perform the movement, lie flat on your back with your legs extended, placing a pillow under your knees if needed. Point your toes downward toward the foot of the bed and hold for 2 seconds, then pull them upward toward your shins, and hold for 2 seconds. Complete 10 pumps. After that, rotate your ankles slowly 10 times clockwise and 10 times counterclockwise. Perform 3 sets each morning before getting out of bed, moving slowly and deliberately so the muscles fully activate. As the first exercise in the ranking, ankle pumps establish circulation and joint readiness, creating the foundation for the stronger mobility and stability work that follows. Number 4 on the list is supine heel slides. This exercise restores knee mobility without placing compressive load on the joint, which makes it particularly valuable for older adults who experience morning stiffness or osteoarthritis. By allowing the knee to move while the leg remains supported by the bed, heel slides provide a safe way to activate the joint before standing. When the knee remains immobile during sleep, synovial fluid inside the joint becomes stagnant. As lubrication decreases, stiffness increases and the joint may feel tight or resistant during the first movements of the day. Heel slides address this directly by moving the knee through its full range of motion while body weight is not compressing the joint. This motion circulates synovial fluid, nourishes the cartilage surfaces, and reduces the grinding sensation many people notice when they first begin moving in the morning. During the lowering phase of the movement, the quadriceps muscles also engage eccentrically, meaning the muscle lengthens while under tension. This type of strength is essential for real-world movement such as walking downstairs, lowering into a chair, and controlling body weight during daily activities. Research supports the effectiveness of this movement. A study published in the Journal of Orthopedic and Sports Physical Therapy found that patients over 70 who performed heel slides daily for 12 weeks, experienced a 35% improvement in knee function scores and reported less pain during daily activities. Additional data from the Arthritis Foundation indicates that osteoarthritis affects more than 54 million Americans, with the highest prevalence occurring in adults over the age of 75. To perform the exercise, lie on your back with both legs extended. Slowly slide one heel toward your buttocks along the surface of the bed while keeping the heel in contact with the mattress. Bend the knee as far as comfortable. Hold that position for 3 seconds, and then slowly extend the leg back to the starting position. Throughout the movement, keep the kneecap pointing toward the ceiling to prevent uneven stress on the cartilage surfaces. Perform 12 repetitions on each leg for 2 full sets. For progression, placing a plastic bag or pillowcase under the heel can reduce friction and increase muscular demand during the movement. In the progression of this ranking, heel slides represent a clear escalation from the previous exercise. While ankle pumps primarily activate circulation, heel slides move into joint lubrication and structural knee mobility. This step shifts the focus from vascular activation toward joint preservation, addressing stiffness and early degeneration risk while preparing the knees for safe movement during the day. Number 3 is supine marching. This exercise strengthens the hip flexors and deep core stabilizers, 2 muscle groups that are essential for lifting the leg during walking. When these muscles weaken, the mechanics of walking begin to change. Instead of lifting the leg normally, the stride shortens and walking gradually becomes a shuffle. As the feet barely clear the ground, the likelihood of tripping increases, which is why weak hip flexors are strongly associated with fall risk in adults over the age of 75. The movement targets the hip flexors, the deep abdominal stabilizers, and the lower core musculature. The hip flexors are responsible for lifting the leg during each step of walking and allowing the foot to clear the ground. When they become weak, stride length decreases. Walking becomes a shuffle, and the feet remain closer to the floor, increasing the chance of catching on small obstacles. Proper neuromuscular activation during this exercise is important. Keeping the lower back pressed firmly into the mattress ensures that the core muscles remain engaged and prevents the hip flexors from pulling excessively on the lumbar spine. The controlled lowering phase of the movement further increases core activation and improves coordination between the nervous system and the muscles responsible for lifting the leg. Research supports the importance of this muscle group. A landmark study published in the Journal of the American Geriatric Society followed over 2,000 adults aged 75 and older and found that hip flexor weakness was the strongest predictor of future falls. Additional supporting research from the University of Pittsburgh showed that controlled hip flexion training produced a 22% improvement in walking speed and nearly a 40% reduction in fall risk. To perform the exercise, lie on your back with your knees bent and your feet flat on the bed. Place your hands on your lower abdomen so you can feel the core muscles engage. Lift your right knee toward your chest while keeping your lower back pressed firmly into the mattress. Hold the position at the top for 2 seconds. Then lower the leg slowly and repeat the same movement on the opposite side. Lifting both legs once counts as 1 full repetition. The routine should include 15 repetitions per side for 2 sets. Throughout the movement, focus on maintaining core engagement and emphasize the slow lowering phase to maximize muscular activation and coordination. In the progression of the ranking, this exercise represents a clear escalation from the previous section. While the earlier movement focused on joint mobility, supine marching shifts the emphasis to functional walking mechanics. The progression now moves from circulation and joint lubrication into gait control and fall prevention, introducing the first exercise in the sequence that directly targets the mechanics associated with real-world fall risk. Number 2 is straight leg raises. This exercise targets the quadriceps, the primary muscle group responsible for standing, walking, and controlled sitting. Quadriceps strength plays a central role in mobility after the age of 75, and it is one of the strongest predictors of whether an older adult can maintain independence in daily movement. The movement activates the quadriceps femoris group, which performs several essential functions during normal mobility. These muscles straighten the knee, support body weight when standing, control the descent when sitting down, and stabilize the knee joint during walking. As people age, quadriceps strength naturally declines, and without targeted strengthening, this decline begins to affect leg stability and overall mobility. One of the most important strength stimuli in this exercise occurs during the lowering phase. This phase creates eccentric loading, meaning the muscle lengthens while under tension. Eccentric contraction is particularly effective for building strength in older adults because it places controlled resistance on the muscle while maintaining joint safety. Research clearly shows how important quadriceps strength is. After the age of 70, quadriceps strength decreases by approximately 3 to 5% per year. If it is not actively maintained, a clinical study published in the journal Age and Aging found that adults with weak quadriceps were 3 times more likely to need assistance with daily tasks and 5 times more likely to require a mobility device within 2 years. Additional rehabilitation research published in the Journal of Rehabilitation Medicine reported that progressive straight leg raise training produced a 47% increase in quadriceps strength and a 61% lower risk of fall-related injury. Number 1 is the glute bridge. This exercise activates the posterior chain, the most critical muscle system for stability after the age of 75. If only one exercise could be performed in bed each morning, this movement delivers the broadest functional impact for mobility and fall prevention because it engages multiple muscle systems responsible for posture, balance, and body control. The glute bridge primarily activates the gluteus maximus, the hamstrings, the lower back extensors, and the deep spinal stabilizers. Together, these muscles form what is known as the posterior chain. The posterior chain plays a central role in maintaining pelvic alignment, stabilizing the spine, controlling posture, and maintaining the body's center of gravity during standing and walking. As people age, prolonged sitting becomes common, and this often leads to reduced glute activity. Over time, the brain gradually loses its ability to efficiently recruit the glute muscles, a condition sometimes referred to as gluteal amnesia. When the posterior chain weakens, the pelvis begins to tilt forward. The spine gradually loses its natural curvature. Posture collapses forward, and balance becomes unstable. Glute bridges reverse this pattern by driving hip extension, stabilizing the pelvis, and strengthening the entire posterior support chain. One key activation technique is to squeeze the glute muscles before lifting the hips, so the correct muscles initiate the movement. Research strongly supports the importance of this muscle system. A major clinical trial published in The Lancet tracked over 3,000 adults aged 75 and older and found that posterior chain weakness was the #1 modifiable risk factor for falls and loss of independent living. Additional behavioral data from the University of Southern California found that the average adult over 75 spends more than 10 hours per day seated or reclined, which contributes to progressive glute inactivity. In the same clinical research context, participants who regularly performed glute bridges experienced a 58% reduction in fall risk, a 44% improvement in walking endurance, and a 71% lower likelihood of transitioning to assisted care. Additional activation research from the University of Queensland showed that maintaining continuous tension during glute bridges increases glute activation by 40%, compared with resting between repetitions. There you have it, 5 bed exercises that prepare the body before the first step of the day and address the systems most responsible for mobility after the age of 75. Stretching can improve flexibility, but flexibility alone does not provide the strength, stability, and neuromuscular activation required to move safely. These movements target the key areas that determine real-world mobility: circulation in the lower legs, joint lubrication in the knees, control of gait mechanics, quadriceps strength for standing and sitting, and finally the posterior chain muscles that stabilize posture and balance. The entire routine can be performed directly in bed, requires no equipment, and takes less than 15 minutes to complete. What matters most is consistency. Performing these movements each morning before standing allows the muscles and joints to activate properly. Before bearing weight, over time, increasing repetitions, extending hold times, or adding light resistance can gradually improve strength and stability. With regular practice, movements such as standing from bed, walking across the room, or navigating daily activities can become more stable and controlled, because the muscles responsible for balance and mobility are already activated before the day begins. If you found this information useful, consider subscribing to the channel so you do not miss future videos covering evidence-based strategies for maintaining strength and mobility as you age. Thank you for watching.